Dr. Anita Parker here, helping you achieve even more success in your chiropractic career. So one of the questions I've received recently is, how do you get more effective with the thoracolumbar junction adjusting? I know that many of our patients, especially female patients who come in, their bra strap often sits in that area and it pulls on that mid part of the back, creating tension, stiffness, and of course, subluxations. So let me show you some ways that you can maybe implement to help your patients even further to get that area released and of course, give them more motion and function, which is what we're supposed to do. So I'm in my model over here. I'm just gonna kind of show you ways that you might want to warm up the back. So what I'm doing right now is actually palpating her, trying to find out what segments need to be adjusted. But as I'm palpating, I'm also trying to add a little bit of a therapeutic benefit by sort of tractioning her spine, stretching it. And honestly, as I'm doing this, kind of strange, it starts to kind of pop and move around a little bit. It's already giving a little bit just by doing this palpation technique, which is helpful because the patient starts to relax. This area is the area I'm talking about that many patients get a lot of those subluxations that we want to treat. But because the diaphragm is directly underneath that area, it can be challenging for the patient to relax or to allow you to really give that full adjustment in. So just a few things that you can do. Traditionally, you can, of course, when you're about to adjust, give them the breath in, breath out, but sometimes I decide not to do that. I just follow their breath to let them relax and then they're not waiting on it. The other thing that helps is because this angle is kind of awkward. It's changing, it's a transitional angle. So my hand is on the angle right now, and you can see it kind of looks flat, but in the thoracolumbar junction, it's actually angling this way. So it's kind of going cephalad a little bit. So what I want to do, and I'm bringing that up to you, is what makes this more effective and comfortable is for you to be behind that angle. So make sure you're not on top like this. You want to be behind the angle so that when you do thrust, most of your actual line of drive is going to be directed properly into that angle to give you that adjustment. So that's the first common mistake that I see a lot of new practitioners start to do, is they are on top. So you want to be behind, okay, when you're about to get it. So as I'm adjusting here, I can do my tissue traction up like this, and you'll notice I'm using a flat hand to make it more comfortable. Oftentimes when I do thenars like this or the edge, it can be a little bit more stressed on the patient and they're going to wait for it and it's not going to let them relax. So if I do a flat hand like this, I'm behind the patient, my legs are separated. So as I tissue, I'm gonna have her just, I can have her deep breath in and out, but if you feel more comfortable just going with her breath, when I know she's ready, I'm just gonna thrust, just like that, and it released, okay? So one segment released, and if it doesn't release, of course you can thrust again to kind of get that motion in, and you'll see how I'm just going, this is my thrust, I'm going leaning kind of from her feet towards her head, so going cephalad, and thrusting kind of P to A at the same time. So it's two moves, P to A and from foot to head, okay? So that's the line of drive to get that adjustment. Now, let's say it doesn't move and you want to get some more motion in there. Drop table is an excellent tool for this area as well, especially with the diaphragm not there to bug you as much. So on this patient here, I'm going to go ahead and have her slide down just a little bit more. And I'm just going to make sure her TL junction, the thoracolumbar junction, is on the drop table segment. And then of course, I'm just going to make sure it's ready for her, the right tension, test that out before I start pressing on her too much. And then on this, when you do have the drop table, I usually use the same technique, meaning I'm behind the angle, so I'm away from her a little bit, and I'm still going with the same line of drive to get that effective adjustment in. Because it's drop table, they're usually allowing themselves to relax a bit better, so you can have them take a deep breath in and out, and when she breathes out, that's when I thrust. Okay, great ways to get that thoracolumbar junction. The most important thing you can do is to continue to add motion in that area, every single adjustment for your patients that need it so that they can breathe better, feel better. Hope this tip helped you. Please keep your questions coming and I'll be back again soon.